that's just amazing that somebody has to
Yeah, they have to live with that.
live with that.
Yeah.
And then here you have, we were talking before we went on, we have the shooting that just happened in Oregon and the shooting in Seattle. And so we have our first responders here who had to deal with Isla Vista, but now they're dealing, you have all these memories coming back, every time these events come up in the news. And I'm sure that must be difficult.
It's very difficult. And
you have to almost avoid the news.
Yeah, you can re-trigger those incidents, and often they do avoid the news in that respect because they've got enough on their plate as it is, and that's why it's a serious issue, and there's a very high rate of burnout among first responders and physicians and nurses. There's a huge rate, and we're losing our best people, and that's why we created this project.
I was just going to ask, so then now we have this video,
right.
Oxygen for Caregivers. So tell us, what will we see when we see the video? What are some of the details?
Well, you'll see local people talking very candidly about what they face. Dr. Coombs, local urologist, and Dan Calderon, local sheriff, Father John Stephen Hedges, he's a chaplain involved with a lot of he's the chaplain for the sheriff's department. You'll see a lot of nurses from the neurology unit at Cottage Hospital, as well as the subacute unit. There are people who have tough jobs to do, and they face this. The burnout, the compassion fatigue, the vicarious trauma, there are specific things. And what the video does is it destigmatizes them. They're not a syndrome. They're not an illness. They're not a personal failing. They're an occupational hazard. And just like if you're going to walk through a construction zone, you're expected to wear a hard hat. Right? Nobody thinks you're a wimp for doing that. It's just the sensible thing to do, right?
Don't wear the hard hat.
Yeah.
Be brave.
Right, exactly. And here comes the hammer, right?
Yeah.
And so what this project is the equivalent of a hard hat for these people.
Sure.
Is what do we put in place ahead of time? So it's not the post-event processing that is also incredibly necessary, but it's what these people put in ahead in their lives ahead of time to be more resilient. And so we will cover the ABCs of resilience that we've discovered in the process of doing this project.
Wow. Now, what are some examples of compassion fatigue that some of the folks have faced?
Well, the aspects of it is, I think one of the most tragic aspects is you're a caring, dedicated person, and you're starting to feel numb and not be able to care so much anymore, when that's who you were.
Right.
But you've seen so much for so long. I mean, we're not talking about one or two incidents. We're talking about hundreds over years.
Right.
And eventually you're tapped out. So that's why we wanted to make a splash with this event. It's it's coming up next Thursday, and we wanted as many people as possible to know about it, especially the team leaders and the instructors in these fields, because it's a tool that they can use. I mean, we built it not just as a video to show, but it's a program that they can take and run with and look about after for their people.
Right.
The videos, it's really, we tried to make it both informational and inspirational. So it's not just what to do, but it's why. And that's why, and the event, it's free for everybody who comes. It's going to be part cast party and part introduction of the work. So we'll have some presentations afterwards. Well, actually a panel by some of the experts who participated in the program. Mm-hmm. So we welcome anybody who's interested in this topic. We realize it's a tough topic. But I think what you'll find is the folks who face the toughest stuff also have the best senses of humor.
Wow. In case you're just joining us, you're listening to In the Public Interest, and my guest this week is Simon Fox. He is with Adventures in Caring, and we're talking about a new documentary / training video. It's called Oxygen for Caregivers, and there is a premiere of the video, which will be on Thursday, June 19th. To learn more about either the video or Adventures in Caring, the organization itself, you can go to their website, adventuresincaring.org. Again, that's adventuresincaring.org. Or simply send them an email if you'd like more information. That's info at adventuresincaring.org. Again, info at adventuresincaring.org. So the premiere then is for the general public. Anybody can come.
It is, yeah. It's free. We're definitely welcoming, especially the folks who are interested in our healthcare workers and our emergency services folks, those who support their efforts and those whose friends and family are those people.
Right. So it sounds like even though first responders, et cetera, are having to do more and more with less resources, it sounds like Adventures in Caring the organization is offering more opportunities for these caregivers to have some help.
We are. And actually that phrase you just used, more and more with less and less, eventually becomes absurd.
Yes, it really does.
Because, the logical conclusion is then you can do everything with nothing. And then that's sometimes what these folks are being expected to do. So that's why, yes, we're very highly motivated to do this, and we scheduled it at 4:30 in the afternoon so that hopefully people's shifts have ended or they can get there and have a drink, have some snacks, enjoy it, meet fellow workers in the field, and then be introduced to what is essentially a new way of looking at this problem.
Right.
We called it Oxygen for Caregivers because we wanted it to be a breath of fresh air. We wanted it to be renewing for the folks who participate in it, and be a new way of looking at the whole thing.
Right. So tell me then also about first of all, what types of organizations could use this training video? And then tell me, you were showing me before we went on the various items in the toolkit. Tell us about that and how can people use this and who should?
Right. Well, the types of organizations that can use this are hospitals, emergency services, whether it be the fire department, the police department, the paramedic and ambulance services, the skilled nursing units and the subacute units, and even residential care. I mean, the level of severity as people age is getting with more acuity seen, even in the residential care with Alzheimer's and stroke and things like that. So that's the kind of organizations that can use this. And the package itself, what's in the program, is not only video, it's an entire workbook for everybody who takes the program, 76-page workbook. There's a leader guide on how to teach it all.
Okay.
There's the slides and all the printed materials and handouts a leader would need. So essentially, it's a train the trainer program in a box that any leader, any team leader who cares about their people, or any unit director has something that they can tangibly use and communicate to their people, to look after your own people. That's the point of it.
That's the huge point, is to look after. So how do organizations then obtain a copy of the toolkit? How do they go about doing that?
Well, we created a special website for professionals in the field. It's www.compassionedu.org. And that's got a lot more detail. The Adventures in Caring site will also link you through to that.
Okay.
But for professionals, they can find out a lot more detail. They can actually see previews of the video, and they can see previews of the workbook and the leader guide there.
And that website again is?
CompassionEDU.org.
CompassionEDU.org. And that's for the professionals in, like, the police department or sheriffs, what have you.
Yeah, healthcare, anybody in healthcare or emergency services, first responders, yes, exactly.
So what are some of the dangers, if you will? I hate to use the word dangers. With compassion fatigue, looking down the road, like say over the next several years, what are some of the things that we should be worried about as far as our caregivers today? Is there a worry about them, leaving the industry because they just can't cope anymore, or what types of
I would say that's the biggest worry, is that we lose our best people, and with them we lose leadership and certain standards of care.
Wow.
And that's huge, because then if that disappears, you can't even teach the next generation because it's gone. And that's the worry. And when you start losing leadership and a lot of people are getting out, some of the best physicians, you've got about a third of physicians who may be clinically depressed.
Right.
The burnout rate of physicians is around 45%.
Burnout rate is 45%.
Yeah.
Among physicians.
Among physicians.
And that's just that one aspect
Right.
of the industry.
Nurses, the nursing profession experiences more on the job violence than any other profession.
Wow.
And so, what causes compassion fatigue? Getting assaulted at work.
Sure, yeah. Going to work and not knowing if you're going to be assaulted
exactly.
or not.
And it happens a lot, especially in emergency rooms, trauma units.
Well, we're just about out of time, Simon, but one more time, let's give out all the information about how people can attend the premiere, how they can sign up for the toolkit, all that good information.
Thank you. Yeah, we do need reservations for the premiere because we're doing it in the New Vic Theater, which we're thrilled about. Right. And it's got about 290 seats, so, they're filling up fast. Okay. So please call our phone number. Paige will take the reservations, and that's 805-962-4500, 805-962-4500, extension 7 will get you right over to her desk. Or you can look at our website, www.adventuresincaring.org. But please respond, or you can respond by email if you like, which send it to info@adventuresincaring.org, and we'll keep a seat for you.
Well, Simon, thank you so much for joining me today, and thank you for this wonderful information, and good luck with the video and with the documentary and with the event itself. It's great that you're doing this work.
Thank you, Jim. Appreciate it.
You're welcome. And you've been listening to In the Public Interest. Again, if you'd like more information about Adventures in Caring, their website is adventuresincaring.org. Again, adventuresincaring.org. Thank you so much for listening. We'll catch you next time. Bye-bye, everybody.